Hey, it's Mark Thompson with the Mulligan Concept Teacher Association. And I just want to go over a couple mobilizations with movement that you might find successful at working on a stiff or a painful ankle joint. Now, in this case, when this patient lunges forward, they're getting a pinching in the front. They're getting some pain in the front of their ankle, the lateral anterior ankle pain. First thing I might try would be a dorsiflexion MWM using my belt in the same position where they're having their symptoms. I'm going to take my belt, I'm going to bring it around him, and with this belt is going to be applying a force along his tibia and fibula in an anterior direction. My hands here, all they have to do is hold the foot down. And I'll get those hands in a kind of a web space grip like this over the top of the foot, and I can even support his arch a little bit if I want to, but I don't need to worry about pushing the talus posteriorly. I'm just trying to hold the foot down. Then what I'm going to do is get my belt short enough that I can get some contact between his knee and my inside shoulder. From here, I get my belt in a good position, about 3 to 4 fingers above the insertion of the Achilles tendon on the calcaneus. That's a good spot. And now I'm ready to go. And as he lunges forward, I apply that force and I just go down with him. And back up. And I may work different directions. If he tells me that still hurts, I might tell him to push his knee a little bit into my shoulder a little more. Veer off a little medial, a little lateral. I'm still not having much success with that one in this case. Don't forget to go to the distal tib fib. Very common area that may be involved. So if I get him on a plyo box, or in this case, I'll just scoot him right over to the edge of the plinth here, drop down, and what I may find is that if I apply a posterior encephalad force on that distal fibula, and he comes forward, I'll ask him how his symptoms are as I keep that force going. Sometimes the distal fibula is a component, but so is the proximal. What if I apply a posterior cephalad force distally, and at the same time, a little bit of an anterior force on the proximal tib fib area? Sometimes that's as smooth as butter right there, and that's just what they need. And that's what we're looking for with all our mobilizations with movement, is pain-free functional movement being restored. Hope that helps. Good luck in the clinic with this. We hope to see you on a course soon.